Good evening and welcome to a series of critical conversations that we're having uh, along with Scroll, Pi Consulting, and Survivors Against TB. These conversations are focused around the issues of health, development, art, music, and other key issues during this pandemic. My name is Chapal Mehra. I am a public health specialist and a writer. And today we are going to be discussing our health, your and my health, in a post COVID world. The term post COVID has only recently come to be used because we thought that the epidemic had a shelf life. But as we learn to live with this epidemic, and the WHO and other key organizations tell us that we have to learn to live with this epidemic for the next 2 to 4 years, perhaps, we need to understand and evaluate what is the meaning of health and our health in this post-COVID scenario, because COVID is now almost everywhere. Uh, we will try to have this conversation both in English and Hindi. So सबसे पहले मैं ये कहना चाहूँगा कि कोरोना वायरस महामारी होने के बाद जो हमारे स्वास्थ्य की सोच है, स्वास्थ्य के बारे में सोच है, हमारी अपनी निजी स्वास्थ्य और समुदाय के स्वास्थ्य की भी बात करें तो वो बहुत बदल चुकी है। और वो किस तरह बदल चुकी है, कैसे बदल चुकी है, और हमें अपनी तरफ से और आसपास जो हमारे समाज है, लोग हैं, उनके आसपास से किस तरह इस स्वास्थ्य को हम समझें, उसको जीवन साझा करें और किस तरह अपना बचाव करें, ये समझना बहुत ज़रूरी है। जिससे पहले मैं अपने गेस्ट को इंट्रोड्यूस कराऊं, आपको बता दूं कि हम सवाल लेंगे आपके। हमारे गेस्ट एक बहुत जाने माने एक्सपर्ट हैं, तो इंग्लिश या हिंदी किसी भी भाषा में आप हमें ये सवाल पूछ सकते हैं, और हमारे ट्विटर, फेसबुक, इंस्टा कहीं पे भी आप ये सवाल पूछ सकते हैं। हमारी टीम उसे हमारे तक लाएगी और हमारे एक्सपर्ट जहां तक हो सके उसका जवाब देने की कोशिश करें। We are taking live questions. We have a well-known expert with us, so please do not hesitate. No question is an irrelevant question in these times, and our topic today is about our collective health. So anything that you want to ask, go ahead and ask it. We will try and bring it to the attention of our expert. So without further ado, let me introduce our guest for this evening, Dr. Lance Pinto. Thank you so much for being with us today.
Always a pleasure, Chapal.
I think we've had you on the show before, but you are in the thick of the COVID-19 epidemic in a sense that you're seeing the cases, and you've before that seen some of the worst cases in tuberculosis, another very contagious disease, at least in pulmonary TB. But I want to start by asking you, you're in the thick of it, you are based in a city which is also heavily affected by this pandemic. And at the same time, what we are witnessing is that we are panicking around this epidemic, right? We're panicking around our health. I have never seen people become more concerned about their health. A lot of us took our health for granted. हम अपने स्वास्थ्य को लेकर इतना चिंता कभी नहीं किए हैं, कभी ये नहीं सोचा कि किस तरह इससे लड़ें, किस तरह अपना बचाव करें. So how has our conception of health changed? People smoking, drinking, eating out, doing all that has stopped, and all we are obsessed with now is our health. So how has our concept of health changed?
So I think the antidote to panic is always knowledge. To answer your question, when you talk about what can we do to avoid panic in this situation, I think being concerned about your health is always a good thing. So if it took COVID to make us realize that, maybe that's one of the few benefits of having the pandemic. If it's made us realize things about our health, but I think one unfortunate reality of COVID is that it seems to have affected individuals with lifestyle diseases or diseases of lifestyle or non-communicable diseases or NCDs heavily. So, if you take apart the fact that the elderly are more affected, among individuals who are middle-aged and young, the ones who seem to be most affected are individuals with diseases such as diabetes, high blood pressure, individuals who have smoking-related lung damage such as COPD, Individuals who are obese tend to do poorly, and therefore this is kind of been an alert for all of us to look into our lifestyle choices and do the best at optimizing them. Make sure that all the background illnesses that we suffer from are well controlled and are monitored regularly. And I think that's the kind of awareness that COVID has brought about. In terms of what can we do to reduce panic, I think we should be a lot better than where we were at the start of the epidemic. So at the start of the epidemic, we knew nothing about the disease. We knew nothing about what can be done to protect ourselves. We hardly had any drugs which had any proven benefit efficacy. And I think that knowledge has improved over time. So if you look at a country like Japan, they followed the strategy of 3 C's. So avoid closed spaces that have a poor ventilation, avoid crowded places, and avoid close contact. And I think these are very simple measures that we can adopt as well. So no going into a mass communal gatherings of people, whether it's a marriage, whether it's a party, whether it's a religious occasion, for example. You would try and avoid getting into a closed space. You would try and avoid being in crowded places with people, and always maintain physical distancing. Masks have been a boom. I mean, we've been exposed to diseases, airborne diseases, or diseases such as tuberculosis for a long time, and yet we've lived with this kind of bravado, assuming that nothing's going to affect us. And I think masks are a step forward. So as long as you've taken all these precautions, I think there is no real need to panic, because we are empowered with this knowledge that if you follow these precautions and you keep your background illnesses in check, you keep your comorbidities under control, you are likely to either not get infected, or if you do get infected, you possibly will have a mild version of the disease.
I mean, I think it's very important what you said, Apne jo kaha, that we are now more aware of our health. We are now more concerned about it. I have never had more requests to focus on strategies for self-care, strategies for nutrition, strategies for managing stress. A lot of people who respond to our programs ask these questions, that can the expert please guide us on this? You think we are more frightened now? We've suddenly realized that we are less, we are no longer invincible. And that the bravado that you were talking about is no longer going to hold.
Yeah. Especially because of the disparities that we see in social structure in India. The ones who are rich very often assume that there are certain diseases that can never touch them. The ones who are poor very often are fatalistic and accept a lot of the diseases, not knowing or not being aware of the fact that simple measures can sometimes make them better equipped to deal with it, despite their socioeconomic disadvantage. And I think COVID, in that sense, has been a leveler. It's a disease which has affected the rich and the poor. So the person who goes to another person's house to work, for example, as doing household duties of whatever sort, is as afraid of getting the disease from the rich people in that house as the rich people are afraid of getting the disease from the person working in their house. And that's not necessarily a bad thing, in the sense that this is not a disease that picks and chooses people. This is a disease that makes us all realize that at the end of the day, we are all human. We are all equally vulnerable. This bravado that we've been living under, this security, this sense of security that we feel because we are maybe rich, because we are in a particular social strata. I think all that has to be rethought of. We need to start thinking in terms of communities, and all our health strategy, all our planning for the future has to kind of deal with health strategies from a community perspective, and not from an individualistic perspective, which used to be the way we thought before.
And I'm glad you said that, because the community has never been more important. We realize that our health is connected to other people's health, and we have to be looking at it collectively. I want to turn your attention for a moment to the system, because people are very frightened of the health system right now. COVID is in a sense the new kid on the block, but our country has high disease burden of TB, of HIV, of cancers, of our immunization is deeply affected. Women's health issues are ignored. I mean, ये सब मिलके, चाहे वो cancer हो, TB, HIV, या किसी भी तरह की महिलाओं के स्वास्थ्य को लेके है, बट द सिस्टम इज नॉट रियली सेट अप फॉर इट. तो जो इंडिविजुअल है वो किस तरह अपने आप को, अपनी परेशानियों को मैनेज करे, बिकॉज टुडे इट्स सो हार्ड टू लैंड अप इन अ हॉस्पिटल, राइट?
Right.
What should they be doing?
So, I mean, that's a very important question. So, I work at a tertiary care institute. So, I don't see people who normally come in with coughs and colds and minor ailments. I see people with severe disease generally. And yet, despite having that kind of a cohort of patients that see me, all of us have noticed a huge drop in the number of patients. So clearly, individuals with severe disease haven't just vanished away. Individuals with serious respiratory conditions haven't vanished away. It's clear that these individuals are petrified of making contact with the healthcare system right now, and are choosing to probably silently suffer at home rather than take the chances of approaching the healthcare system and risking uh, the possibility of acquiring COVID. And if this is happening for serious illnesses, I can only imagine, things which are preventive, like vaccinations, like regular health checkups, etc. I can only imagine that they are severely affected because there's no felt need there. There's no felt need for a vaccination. You're not sick. You do it as a preventive measure. So if you aren't really approaching a hospital to get treated for a felt need, what is the probability that you would approach a hospital for something that's preventive? So I think that's a huge problem, and the faith needs to be restored. So I know for a fact that the hospital I work at, we've taken a huge number of measures to try and protect individuals at every step of the way, from simple measures like just wearing a mask to having hand sanitizer dispensation stations everywhere, wherever you want to see them. And I think we need to restore the faith of most individuals in the system, that all measures are being taken to make sure that individuals are protected at all times. The other issue, of course, is infrastructure and manpower. So, even in the background, even before COVID, I think we were struggling with a lot of diseases such as tuberculosis, such as HIV, such as malaria, dengue. We've always struggled with these diseases, especially in the monsoons. And with that background struggle, we now have a new struggle with COVID. And that's unfortunately not a problem that's going to get solved overnight. I mean, how much infrastructure or manpower can you build overnight? So I think that's the wake up call. That's the wake up call for the future. That if we are struggling with the existing disease burden, there's no way we can manage a new problem that comes out of the way, and that calls for better preparedness in the long run. So to answer your question, I think we need to restore faith in individuals so that they can approach the healthcare system. And I think all of us in healthcare are working very hard to protect patients. I don't think we would want any of our patients to come see us acquire a disease and go back, acquire COVID and go back. So a lot of precautions are being taken. So I think people need to gradually not suffer silently, but approach the healthcare system if they do have problems, because those problems itself might be risk factors for acquiring COVID.
I mean, one of the things that a lot of people are saying is that we will have a surge of diseases as the system opens up, because people are trying to avoid. And one of the things that we keep getting requests for instance, regularly, जो हमसे पूछते हैं, अरे मेरे को टीबी है, अगर मुझे कोविड हो गया तो मैं बचूंगा कि नहीं, मुझे कैंसर है, मुझे कीमोथेरेपी करानी थी, मगर मुझे बहुत डर लग रहा है, आई डोंट वांट टू गो टू द हॉस्पिटल टू गेट माय कीमो डन, I don't want to go to. I have been running a fever for 5 days, but I would not like to land up in a hospital. Now, these are genuine fears. I mean, you can't really run away from them. What would you advise these individuals? Because some of it is paranoia, some of it is fear.
Right.
It is not misplaced,
Right.
and some of it is just genuine concern.
So again, all I can say is that the principles that apply to COVID when it comes to general life are the same principles that would apply to COVID when you're approaching a hospital. So you would want to have an appointment when you see your doctor. You wouldn't want to just walk in and wait forever to see your doctor. My hospital is not allowing people to walk in at the moment. You have to have an appointment. So you would want to make sure that your waiting time in a crowded area is limited to as less as possible. You would want to make sure that you're wearing a mask at all times when you approach it. Be assured that your healthcare provider is definitely wearing a mask and taking all precautions at their end. And basically the same principles apply. So as long as you stick to the same principles, you adhere to the same principles, I think number one, it's not a bad idea to go and see your healthcare provider. If you still feel reluctant, most of us have opened out pathways of telecommunication, of teleconsultations, which I think could be your first step as a stopgap before deciding whether you are ready or not to go and see your doctors. In the public healthcare system, overcrowding tends to be a problem generally. So I can see the concern there. But again, as long as you're wearing a mask, as long as you try not to stay in one place for too long, prolonged contact has been shown to be a constant risk factor. I think you should be okay, and you would want to take care of your underlying illnesses because, as you rightly pointed out, अगर लोग डर रहे हैं कि हमको ऑलरेडी प्रॉब्लम है उसके ऊपर हमको अगर कोविड हो जाता है तो वो डर जायज है वो डर जब तक वो अपने अंडरलाइन कंडीशंस भले ही वो डायबिटीज हो या ब्लड प्रेशर उनका हाई है जब तक वो कंट्रोल में नहीं आता जब तक उसकी दवाइयाँ नहीं चल रही है तब तक वो रिस्क तो रहने वाला है सो आई थिंक इट्स वेरी इंपॉर्टेंट टू कन्वे दैट मैसेज टू पीपल
So I think what you're saying is ghabraiye mat, do not panic, but there are certain measures that you need to take, and that is how you need to manage, because you don't want to make yourself vulnerable to COVID, but at the same time you should be managing your ongoing chronic health issues or other health issues that you may be having. Don't ignore them, because that
Absolutely.
is dangerous. Yeah. The other issue that you spoke about earlier that I want to ask you is about community or samudaya, as we call it. How do communities prioritize health? Because the truth is that the government tries what it does, and it tries it to the best of its abilities. But a large section of India's population seeks care in the private sector. At the
Right.
same time, India exists in communities, very close-knit communities, at the village level. Even in the cities, you will notice that people crowd around a certain community, their community that they identify with. How do those communities prioritize health? Because we've seen in the last several months, there have been gatherings, religious gatherings that you were mentioning about. But what is their role in this? Because they can have a pivotal role, right? People listen to them.
Absolutely, and we've seen community come out reasonably strong in this pandemic. So take a city like Mumbai. I know people took the onus upon themselves to make sure that there were oximeters in their housing societies, for example. They took the onus of themselves to welcome people to home quarantine. Once home quarantine was accepted, rather than stigmatizing it, there was an awareness that somebody in our society has COVID. So all of us need to be a little cautious. We will come house to house if you want and check your oxygen levels. We will try and network with local hospitals and try and find you a bed if you are unwell. So I've been part of where I live. I've kind of liaised with people in my community in the area that I live who've created a support help group, which basically you would call them up the moment somebody is COVID positive. You would kind of give them the parameters. If they needed hospitalizations, they would make the phone calls to try and get you a bed somewhere. So I think these kinds of initiatives are very important. The other end is, so for example, somebody who works with me went back to his village, and I know for a fact that when they went back to the village, they were quarantined in kind of a school which was in the village, and everybody who came on that particular bus was quarantined together. When all of them swabbed negative, all of them were taken off quarantine, and this was organized by the panchayat. This was organized at a local level where they figured out a way to make it safe for their communities, for migrants or for people coming back home, people traveling across. And this does not necessarily have to involve big government or big policy. It could be individuals helping each other out or trying to figure it out. Of course, they would need guidance. They would need their local leaders to make sure that what they are doing is scientific. You wouldn't want somebody being exploited because of COVID or being stigmatized because of COVID. But there's a lot that communities can do. Simple things like when you talk about diseases of lifestyles, look at a city like Mumbai. Construction is everywhere, but what are we investing in terms of open spaces? What are we investing in terms of parks, in terms of playgrounds? How are you expected to have your children and your next generation be healthy and fit unless you invest? And I think that is where community can play a very important role. That's the kind of lobbying that's very important, where we invest in the health of communities and not just individuals. I may have a gym membership, but that doesn't mean that I don't care about the community as a whole.
So I think this. Yeah. Sorry. Yeah. Go ahead, please. Yeah.
No, so I think COVID has been an eye opener where a lot has been done despite the resources being limited. So most of us have not just raised our hands and said, "Oh, the government can't do anything. I just have to fend for myself and I don't care about anyone else." I think a lot of us have, in our own small ways, in our own micro communities, whether it's our people who work with us, whether it's people in our community that we know of. I think all of us have reached out in our own way, and I think that is an important principle going forth as well. That it's a very strong tool to have a group of people taking care of each other rather than being in a society where every individual just thinks of himself or herself.
So I think this is really important because I think जो आप बात कर रहे हैं, which is of people coming together as a collective, even a group of informed people can make that difference to try and improve, not just safeguard their health, but और लोगों की भी जो स्वास्थ्य है उसकी उसमें जो भी बचाव कर सकते हैं वो करें. One important thing that I wanted to ask you is, you're a doctor, you know this better than anyone else, the role of nutrition, because right now India is going through a bit of a food crisis. I mean, unemployment has risen. We are only partially open. Half of India really works in the informal sector. People's incomes are low. This is the time, and a lot of work is being done by community organizations here. But what is the role of food here? Because food is essential fuel for us, and it's basically our immunity. So how do we advise people on this?
So I think coming from a background of tuberculosis, I mean, most of my research and my work has been in TB. I think you can't stress the importance of nutrition enough. We know that whenever there have been major disruptions in the world, be it a civil war, be it a famine, be it the breakdown of the Soviet Union, TB rates have gone up. They've significantly increased during these periods of disruption. When supply chains have been disrupted, for example, it has led to increase in the rates of tuberculosis. So nutrition, I know for a fact there's research being done in this field. There's some really good work being done in the field of nutrition and tuberculosis in particular, which suggests that nutrition can play an as important role, if not more, than drugs in TB. The possibility of you acquiring tuberculosis also, or getting infected with tuberculosis also, may be influenced by nutrition. So I think you can't emphasize this enough, and we must anticipate that there is going to be a problem with nutrition, given the disruptions that have happened, given the possible unemployment rates that are going to surge post COVID. And I think there is some, again, I'm a small doctor working in the private sector as an individual, so I don't know what we can do in terms of public health. But in terms of policy, if we could lobby, if we could tell the government in whatever way possible to assure a ration, to assure nutrition is taken care of in some way, I think it will go a long way in preventing the next deluge of diseases that may happen a year down the road or 2 years down the road as a consequence of COVID. And again, this is where someone like you, Chapal, the great work that you guys are doing in terms of lobbying, I think that plays an important role. And I think there are enough experts who will vouch for the fact that there is a clear association between nutrition and disease, and there's a clear association between especially nutrition and diseases like tuberculosis, for example. We might see a surge off unless we act proactively.
Yes, thanks so much for answering that, because I think ये बात बहुत ज़रूरी है कि हिंदुस्तान में कोविड क्राइसिस ही नहीं है, एक फूड क्राइसिस भी हो रहा है, और इस वक्त बहुत ज़रूरी है कि सरकार ही नहीं, not just the national government, but state level governments can also take action on this, and we should all be pushing for it, because I think the moment we have an ensured, asking people to stay at home or maintain physical distancing is unreal in a world where they don't have food. अगर खाने को नहीं है तो लोग तो बाहर जाएंगे ही जाएंगे. So then if we really want to contain this pandemic, one of the things, like you were saying, practice certain measures, but those measures will only come to act if people are not desperate for food. अगर खाने की कमी नहीं होगी तभी लोग कुछ फिजिकल डिस्टेंसिंग या कुछ प्रैक्टिस कर सकते हैं. और ये हम क्लोज में, जैसे आपने कहा, ऑलरेडी देखा है. HIV में बहुत साल पहले एक प्रोग्राम क्रिएट हुआ था जिसमें कुछ पैसे न्यूट्रिशन के दिए जा रहे थे PLHIV को, तो ये बहुत ज़रूरी है. We are halfway, almost close to the halfway mark, and we've already started receiving a lot of questions. So I want to ask you to answer some of them, and I also want everybody who has been who is thinking about these questions to send them to us. अपने सवाल भेजिए. Nabila Khan is asking, and I think this is the core of what everybody is thinking. This is a very useful question. Should we adapt in this coronavirus situation? I mean, should we integrate in this situation? If yes, then how? Basically, she's saying there's the epidemic and we are inside. We go out, kabhi kabhi. Are we going to now? Should we come back to life as normal? Because in a way, that's the topic. Our health in a post-COVID world. I mean, with COVID around, kya kare?
No, absolutely. I think so. That's the advantage of being 6 months down the pandemic, that we have knowledge now, which we didn't have at the start. So the great lockdowns when everything had to be sealed, it had to be done because we didn't know anything about it. Now that we are better educated, there is a lot of evidence out there on the benefits of masks. For example, we know for a fact that if two individuals wear masks and stand at a distance of 6 feet apart from each other, we know that they are very, very well protected. So the risk there is negligible. So we also know that short, brief encounters generally do not tend to spread the virus. It's prolonged encounters, generally more than 10 minutes, more than 15 minutes, where you're sitting together. We know that, for example, if you're speaking in a loud voice, you're more likely to transmit the virus. If you are singing, you are very likely to transmit the virus, because these are things that are very high droplet generating activities. So should we adapt? Of course we should adapt. We should adapt simply because this is unsustainable. If I was confident that we were going to have a vaccine in the next 15 days, and that the entire universe or the entire world was going to get the vaccine, I would say, yeah, wait for 15 days. There's no rush. But the timeline right now looks a lot longer than that. It looks like it's possibly a year, if not longer. And this kind of a lockdown is unsustainable for a year. So therefore, I think we should adapt, but we should adapt with all the knowledge that we have. We can't be fatalistic about it. I don't think that the attitude of "jo hota hai usko hone do, abhi kya kar sakte hain, let's just live our normal lives. Agar hona hai to dekha jayega." That fatalistic attitude is not necessary. That I don't think is necessary. Taking precautions and trying to adapt, I think, is the smart way to go about doing things.
So I think this is really important. Adapt, but you have all this knowledge. आपको सब कुछ पता है अब काफी हद तक अपना बचाव करने के लिए. हमें इस बीमारी के बारे में सब कुछ तो अभी भी नहीं पता है, मगर जितना पता है उसका इस्तेमाल करते हुए you have to start slowly going back to life as you had it earlier, with restrictions, with compulsions, because this is also unsustainable economically, socially, mentally, familiarly. I mean, it has so many repercussions. If I could get you to speak a minute about this vaccine, because the world is obsessed. We did a whole program on the vaccine, and all we heard was, in terms of question, was when, what price, how soon, and I think as a doctor, people will listen to you far more if you could few things about the vaccine. And because there are so many candidates, and there is so much excitement and almost obsession around this. What is the role of vaccine? Kya karenge?
So one thing that everybody needs to remember is that the reason we go through science in steps, the reason we go through something called a phase 1, phase 2, phase 3 trial, is because number one, we want to ensure safety. Most important, do no harm is always the fundamental principle of medicine. The second thing is we want to show efficacy, that something really works, not just because it looks attractive in the laboratory, not because, when you give a vaccine and you take out blood, antibodies are there and therefore you say this is great. That has to convert into a person not getting the disease. That's the final outcome. So these things take time, and there is no guarantee that things are going to work. Just because a vaccine is under development does not mean that it's 100% going to work. Look at HIV, for example. It's been 30 years now since we first encountered HIV. There is no vaccine yet. And that whoever makes that first vaccine is obviously going to do very well. So I'm sure there's no dearth of research in the area, but people have still struggled to get that vaccine. So therefore, the fact that there are multiple candidate vaccines, All of them, of course, are promising. Some of them are very promising, like the Oxford one, which is recently was the Moderna one, is very promising. But that does not necessarily mean that it will definitely have, it'll definitely survive trials and 100% give us a result that has to be positive. So all of us need to be mentally prepared for the possibility that these trials may show no benefit or may show harm. Maybe these vaccines will come at a price and we'll realize that price is too hard to pay. So I don't think we should pin our hopes on the vaccine. If it does happen, great, wonderful for us. We will move on. If it doesn't, we just have to stay safe and we just have to learn to adapt to the new normal.
Yeah, I mean, I think this is also an important thing to remember, that a vaccine is also an attempt, is a scientific attempt to counteract this virus, as are many other attempts, from cure to trying repurposing different drugs, अलग-अलग तरह की दवाइयों का इसमें use करना और देखना कि क्या impact हो सकता है, because the vaccine won't actually be till the vaccine comes and an effective vaccine comes. Your vaccine is really physical distancing, self-care, and balancing a lot of the issues out. Another question that we have, which is I think an interesting question by Sunil Kapoor, and if I'm not wrong, he's also a doctor. He's asking, because of enhanced hygiene, masks, some of the communicable diseases, seasonal diseases, have a lesser incidence now. Is my observation right? And there is a lot of talk about how people will wear masks and tuberculosis will get eliminated by 2025. What are your thoughts on this? Because I think it's an interesting notion to have.
So it's great to be optimistic, and I'm all for optimism. And there is, unlike some of the drugs which are floating around right now, there is plausibility. There is reason to believe that masks might work in the spread of communicable diseases. So I definitely can't, poo-poo that statement. मैं ये नहीं बोल सकता हूँ कि ये बिल्कुल नामुमकिन है. It totally makes sense that you wear masks and the incidence of spread might go down. So in tuberculosis, we know that even simple masks, the whole idea is that the person wearing the mask is the one who's sick. So the idea is that you don't want to spread your droplets to others. So if I wear a mask with a patient who has tuberculosis and it's a simple mask, I will still be as exposed as ever. But if tuberculosis wears a mask, the probability of him generating droplets decreases, the probability of him spreading it decreases. And this is proven. This is proven long time back. So this is not new. Now, a lot of tuberculosis in India, for example, is reactivation tuberculosis, right? You've had TB in childhood. It remains quiet as a focus somewhere in your body. When your immunity goes down, when your nutrition goes down, for some reason, that flares up and reactivates. So that is not necessarily going to go down. In fact, that theoretically might worsen simply because of the disruptions that we just spoke about. So yes, person-to-person transmission might definitely be affected by beneficially affected by masks, but things like reactivation of disease, things like inherent diseases which are there, I would find it very surprising if tuberculosis just vanishes away, with the knowledge that a lot of our TB is reactivation TB. It's not just person-to-person spread.
No, and I also want to thank Dr. Kapoor, because I know him well, for asking this question, because I think there is a lot of work to be seen in here, because he's a leading leading doctor in Delhi. We've started getting a lot of questions, so I'm going to stop talking and ask you all of them. Sumita is asking, Sumita Bandyopadhyay is somebody, and I think this is very relevant to your work, somebody undergoing TB treatment, is he or she most prone to COVID, and if effective, what is the extent of recovery? This is a question we literally get every day. हमें रोज सुनने में आता है हमारे सोशल मीडिया हैंडल्स पे, मुझे टीबी है, अगर मुझे कोविड हो गया, क्या मैं ज़्यादा ससेप्टेबल हूँ? अगर हो गया तो मेरी रिकवरी की क्या चांसेस हैं? इसके बारे में ज़रूर कुछ बताइए.
So to the best of our knowledge, there's no increased susceptibility to acquiring infection with COVID if you have tuberculosis. I mean, there are theories floating about that in some way you are protected. I don't think that's true either. I think you are as prone to getting COVID as anyone else. I don't think you are protected or at an increased risk. Now, if you have TB and you do get COVID, will you have a poorer outcome? It depends on at what stage of TB you are. If your TB is such, if your tuberculosis is such that it's affected your lungs extensively, and you're already at a disadvantage in terms of lung function, COVID could tip you over, and that's true of any underlying respiratory illness. So if you have severe asthma and you've not controlled your asthma well and you get COVID, you will be at an increased risk of a poor outcome, simply by virtue of the fact that your lungs were standing at the edge and something tipped them over. But that's not. I don't think that's a biological connection. I don't think there's a biological interplay between the tubercle bacillus and the virus. It's just the fact that your lungs are probably at a disadvantage, and the viral infection might tip you over.
And another question that we have is, which is also, I think, by Dr. Kapoor, and I think this is also a very important question, because many doctors claim, he asks, that they have treated many COVID patients from home. Whether the drug combinations they use made any difference is not known. They bypass the government notification. Is that allowed? Can it be curbed? I think this is a two-part question, one about cure and one about bypassing what we know as knowledge, because there is a lot to be explored here.
So for me, this is my personal pure opinions based on my reading of the science. If you are home quarantining someone and treating them from home, they shouldn't be on any medications whatsoever. I don't think anything has been really proven to be beneficial for a person who's stable enough to be at home. Whether home quarantine is good, I think it's fantastic. I think it was a turning point for Mumbai. Once they started allowing home quarantine, there was such a huge offloading of the load on the healthcare sector, because individuals who didn't need to be in a hospital weren't at a hospital, and therefore we could really take care of the ones who needed hospitalization, sick. And this whole bed shortage got better the moment home quarantine was allowed. So I think we should definitely encourage home quarantining, provided this is not a high risk individual because of comorbidities or age, provided that they definitely have a pulse oximeter at home and continuously monitor their oxygen levels, provided that the moment the oxygen levels cross, say, 95%, they immediately get admitted and subject them and allow us to take care of them at that point of time. If you're at home, ideally, if someone has taken a decision that you are fit enough to be at home, then you just need to be observed. I don't think you should be on any medicines whatsoever.
I think this is also an important thing. यहाँ पर बहुत ज़रूरी बात है ये बात बताना, that a large percentage, over 90%, if I'm not wrong, and you can correct me, Lance, are recovering from disease. So I mean, and most of them may not necessarily require hospitalization. So while it is very important to be careful and monitor yourself, there is also not a need to constantly panic, because COVID is around us. I mean, it's not going to disappear tomorrow. I mean, what would you say, Lance?
Absolutely. I mean, if you look at the numbers, even from Mumbai, if you look at the seroprevalence numbers, they found a seroprevalence of about 57% in places like Dharavi, and they found a seroprevalence of somewhere around 16% or so in apartments and buildings. Now, if those 16% actually had disease severe enough to warrant hospitalization, the system would have collapsed. I mean, we would have numbers which would have been completely through the roof. If you look at the actual percentage of numbers that we have of both mortality, individuals we've lost to the disease, or individuals who've been severe enough to be hospitalized, it comes out to be a quite small fraction. It doesn't come out to be a huge number. So the infection fatality ratio that we talk about ends up being in a very low range. So I think that's very reassuring data, the seroprevalence data, which individuals, so that's the problem with, if you just hold on to the number of cases being reported in the media, if you just hold on to the number of deaths being reported in the media, you don't realize what the denominator is. You just see the numerator, which is, these many people died. But for every person who died, there are probably 200 individuals who had the disease and who survived and, did well. So I think that's what people need to focus on to avoid panic, that, as you rightly said, most individuals will do very well despite having the infection.
The other thing that we are constantly asked, and we don't know enough. So because you've worked in a COVID ward, you've seen COVID patients very closely, even the ones who have required hospitalization. वो लोग आपके अस्पताल में admit हुए हैं, आपके COVID ward में रहे हैं. we don't understand, and patients keep asking this, and people who are at risk keep asking this. जब कोविड से क्योर हो गए तो हमारी हेल्थ, so I mean that actually goes very well with our topic, our health in a post covid world, तो हमारी हेल्थ पे क्या असर होगा, बिकॉज हम इसके बारे में बहुत कम जानते हैं, we don't really know enough.
So you're right. So what we do know is that individuals who have a severe course of disease, important, severe enough to need oxygen, severe enough to maybe be in an intensive care unit, they could potentially have effects on the lungs that stay there for some time. And we can only say sometime now, right? Because we're talking about a pandemic that just started about 8 months ago. So we don't know what's going to happen a year down the road. We don't know what's going to happen 2 years down the road. I have seen a lot of patients with really bad CT scans, looking really bad in terms of when they presented to the hospital. Eventually, when I've met them after and I've said, do you feel like you're back to normal? They say we feel like they're absolutely back to normal. So that's one reassuring end of the spectrum where the the severity of the disease at the onset or the severity of what it looks like on a CT scan may not necessarily correlate with how well people recover or not. There is also another story to it, though. There are some individuals who seem to be left with residual fibrosis for a reasonably long time. There are some individuals who are reporting, heart ailments, things like problems with the musculature of the heart over a long period. There are individuals who seem to be prone to developing clots for some time, even after the illness. A lot of individuals complain of this incessant fatigue, incessant um, sense of lethargy, which persists for a reasonable amount of time, which is true for some other viral infections as well. So if you ask me the question, एक बार कोविड हो जाता है तो हमारा क्या होगा? मैं ये बोल सकता हूँ कि लॉन्ग टर्म के हिसाब से ऑफकोर्स हम नहीं बता सकते हैं क्योंकि दिस इज टू अर्ली, लेकिन शॉर्ट टर्म में अगेन a significant proportion of individuals seem to do well. There is a small proportion who does seem to have lingering effects of the disease. And I think the moral of the story, therefore, is that we need constant monitoring. So, अगर आपको कोविड हो गया, आप रिकवर हुए हो, अगर आपको बहुत ही माइल्ड इलनेस हुआ है और अगर आप बिल्कुल नॉर्मल हो गए, आपको लगता है कि कुछ हुआ ही नहीं था, then maybe you don't need to be that intensely monitored. लेकिन अगर आप अस्पताल में थे, अगर आपको ऑक्सीजन की जरूरत लगी थी, अगर आप आईसीयू में थे, so for some time you need to be under the radar, you need to be monitored by your doctor, you need to be closely followed up.
Okay. I think that's very helpful to know, and ये बहुत ज़रूरी चीज़ है, that monitoring बहुत ज़रूरी है, और ये इस वक्त हम कुछ भी नहीं कह सकते इसके बारे में जो 100% सर्टन हो, बिकॉज लाइक यू सेड ये पैंडेमिक ही इतना नया है कि किसी भी इसके आउटकम में विश्वास बोलना थोड़ा मुश्किल है. We've got more questions. I think this is an interesting question which has been asked, which is, I don't know who's the individual who's asked this. How will the use of sanitizers over a long period of time affect our overall immunity? Because, there are very many systems of thought. In fact, not just in India, but also across the French believe a little bit of dirt is good to build your immunity. And there are many cultures across the world who think that the obsession with cleaning everything is actually harmful to your immunity. What would you say? मतलब कि हैंड सैनिटाइजर्स को तो हम लोग ऐसे इस्तेमाल कर रहे हैं जैसे कि हैंड क्रीम है, तो फिर उसका लॉन्ग टर्म इम्पैक्ट हो सकता है हमारी हेल्थ पे.
That's an excellent question, and there is this hygiene hypothesis that has been floated for a long time that the cleaner you are, the more likely you are to move towards diseases which are autoimmune, non-infectious, but diseases like arthritis, diseases like whatever, autoimmune diseases basically. It's a hypothesis though. The simple answer I can give to this question is that soaps have been around forever. Soaps have been around for a long time, and I think we have reasonable experience with soap. And we know that if you habitually use excessive amounts of soap, yes, you can get fungal infections, you can have stuff happening to you. But so if you want to choose between a soap versus a sanitizer, whenever you have access to soap, maybe go for a soap rather than going for a sanitizer, because a sanitizer is a new thing. It has alcohol in it. You're absolutely right. We don't know what the long-term consequences of it are. But I think soaps, used sensibly, have not proven to have any major side effects over a century of use of soap or whatever. So this is what I do myself as well. So when you're at home, when you have access to a basin and soap, use that rather than using a sanitizer all the time. Simple hand washing for 20 seconds, as long as you've done it well, will be as effective than as any hand sanitizer. And I think that's a practical tip there.
So I think that's a very practical and very easy solution with no particular side effects or harm, except maybe dry skin, which can also be remedied. But this other question that I did want to ask you, which we are also constantly asked, and actually it's a question that we haven't thought about at all in the health system, because we are so obsessed कि ventilator है कि नहीं, bed है कि नहीं, और कि हमने इसके बारे में बिल्कुल नहीं बातचीत की है, वो है मानसिक स्वास्थ्य और mental health. Now, India has always had sort of silent epidemic when it comes to mental health. We don't have enough mental health professionals. We don't have, and people don't even know it. They stigmatize it. If you are to say to somebody, "I am suffering from depression," which is a perfectly legit thing to say in the health space, most people will say, "अरे कुछ नहीं होता, तुम्हारा दिमाग ठीक नहीं है, ये नहीं है, वो नहीं." Now with this epidemic, we are seeing a literal mushroom of it, right? लोग उभर के बाहर आ रहा है और ये एपिडेमिक हमें मेंटल हेल्थ इश्यूज दे रहा है साथ। तो इसके बारे में आप क्या कहेंगे? व्हाट शुड बी आवर अप्रोच about dealing with this? I mean, should we be looking at dealing with this mental health issue?
So I think, as you've rightly pointed out, it's always been a problem in India. It's always stigmatized. I think we use the word depression too loosely as well. At the other end of the spectrum, we use, I'm feeling depressed today. That's the lingo that we've gotten used to, and I think maybe a move to discourage that. To give it to give the word a bit more gravitas. That when someone's saying that, you need to take that more seriously than just assume that it's somebody who's going through a bad day. I think, and most of that is only going to come from education, from destigmatizing it, from having people who have a following, people who are influencers. And I think it's already happening in the social media space. But of course, that we have to confess that the social media space caters to a very small segment of society. But I think mental health issues are being discussed more freely in that space. I think if we have more celebrities, more people who are likely to influence individuals come out and talk about their own issues, talk about how it's okay to see a psychologist, a counselor, or a psychiatrist. It does not necessarily mean that something's wrong with you. And it's just as any other disease. You would go to a doctor for a cough and a cold. So you would go to a doctor for a mental health issue. I think that destigmatization is important, and that's a big challenge. This is something that we've been dealing for a long time. I think telehealth though has the potential to change a lot of things. The fact that you don't have to stand outside a psychiatrist's office anymore, you don't have to actually make that effort to go to a particular place, and wonder if somebody sees you, somebody bumps into you. The fact that you can do it over a teleconsult, I think is a step forward. However, again, that comes with its own flips. So there's an elderly person who feels that he's going through depression and has to depend on his children to log in to the telehealth portal and connect with the psychiatrist. That's going to be a challenge in itself. So we'll have to find a balance. And I think the most important thing, which cannot be emphasized enough, is that we have to destigmatize it first. The moment we destigmatize it, I think everyone will. It's an empowering experience once you destigmatize it, because then it's the same thing. So medicine is going through the same thing in palliative care. Once you destigmatize palliative care, it's actually empowering, because you can offer so much more to people who you love and you really care about.
I mean, I think this is a really important thing you mentioned about teleconsults. But one of the criticisms जो इसका एक बहुत निंदा होती है, वो ये है कि भाई टेलीकंसल्ट कौन करेगा, क्योंकि भारत में ज़्यादातर लोग तो टेलीकंसल्ट ले नहीं सकते, और ये थोड़ा मुश्किल हो जाता है. तो do you think we should be democratizing it in some way, improving access? Or do you think there is a role for health workers? Because, I was speaking to a former health secretary, and he said to me कि your best hope इस वक्त our health workers who are on the grassroots. आप उनकी skills build कीजिए, उनको ज़्यादा पैसे दीजिए, उनको mental health screening की skills दीजिए, क्योंकि ये अब आप कल तो doctors खड़े नहीं कर सकते, कल hospitals खड़े नहीं हो सकते. So what are your thoughts on that? I mean, क्या सोचते हैं आप उसके बारे में?
I could not agree more. I think we need to decentralize health as much as possible. So when I worked in Canada, for example, there is a title called the nurse practitioner. Somebody who even who can prescribe medicines, who can triage, who can decide when to escalate it to a doctor or manage it by themselves. And I think it's not rocket science. I think doctors have been protecting their turf for a very long time. And I think that needs to change. I think we've been this whole thing about us versus Ayush, us versus them. I think that needs to kind of change. And if somebody in the Ayush sector is ready to get trained enough to offer a certain standard of care, which is evidence based, which has its basis in science, we should welcome it with open arms, because we must realize that we have one of the lowest doctor to patient ratios in the world. I mean, at the end of the day, the number of doctors that we have per 1,000 patients or whatever is very low. And as you rightly said, there's no way to increase that overnight. There's no way to suddenly build up medical colleges everywhere without compromising on the quality of what we expect from the title doctor, right? But when we talk about things like screening, that's not that does not necessarily need to have a same skill set. You want, even for something like mental health, you would want, so when you start off a program, when you start off something, you want to catch the ones that are most likely to deteriorate most rapidly, or you want to triage in such a way that you definitely don't lose patients, you don't lose individuals who are very close to the edge. And that could be a starting point, just training individuals to screen out for that. And then you can build on that. Then you can kind of figure out ways where you serve everybody, even the ones with mild illness. And I absolutely agree. I think we need to decentralize health and empower ASHA workers, empower Anganwadi workers, and create this whole cadre of nurse practitioners, maybe, uh, which would have a far bigger reach than this ambition of increasing the number of doctors or improving tertiary healthcare.
And I think I want to add to what you said by saying to our viewers that the best nurses in the world come from India. We
Right.
literally export plane loads of nurses to the rest of the world, but that is a model we
And
should
that's
think
and
of.
that's such a pity, right? It's a reflection of how we don't incentivize it enough.
Yeah, because we barely pay them, and that's very
Right.
important to remember. I've got more questions, and I've got only 7 minutes left, so I will ask you to answer them briefly. But these are important questions. Varshita is asking if I've been exposed to a COVID positive person, should I get myself tested even though I'm not experiencing symptoms? This point of when you should get a test is so critical, because we've been told that most people are asymptomatic, so asymptomatics are also spreading. What is the
Right.
protocol?
So do not get tested before 5 days. Give it at least 5 days since when you've been exposed to the individual. Now, whether or not to test, I think testing has implications in terms of the precautions that you will take if you are positive. So I think even though it may not change your trajectory if you are asymptomatic, maybe you will take greater precaution once you know that you are positive. If you are in that frame of mind where you say that I will assume that I am positive and I will quarantine myself religiously for the next 2 weeks, then maybe testing becomes redundant unless you are high risk. So you would want to get tested so that if you do deteriorate, you would want a test result that says positive, so you could get entry into COVID hospital quickly. So that would be a high risk category. But if you are low risk and asymptomatic, the reason to test would be to make sure that you quarantine more efficiently.
Okay, this is the second question, because we've got 5 minutes left. Sanjay Berry is asking if there is no vaccine for COVID, which there currently isn't, then will most of us develop autoimmune? What is your hypothesis on a society without COVID vaccine in the long run? I think it's an interesting question to wonder, since we are so obsessed with the vaccine.
So based on what we know right now, yes, we will eventually develop herd immunity. But based on what we know right now, the problems with what we know right now is that so we've currently submitted a case report to a journal of someone who we think was a reinfection. The first reinfection from Hong Kong was reported. and it's been
Yes.
about 8 months into the pandemic. So let's assume this worst case scenario where everybody after a year loses all antibodies and immunity to COVID, then we're back to square one. Now, that's not what we currently think the story is. What we currently think is that most individuals will remain protected for a long, long time. And maybe more than a story, it's also a hope. And if that's the case, yes, eventually we will develop herd immunity. The only problem would be if, if immunity wanes with time. And that unfortunately is a real possibility.
I mean, those are possibilities that exist, and I think one should be prepared for those, because the more we try and look at silver bullet solutions, we are trying to not necessarily put notions that may or may not work. I think the fundamentals in any improbable situation, fundamentals that, like you were saying, what we know is what we have to use to practice it. We can't look into the future and start prophesizing things all the time, because that may not
I mean, we, we,
necessarily
can,
for
we can
every.
be hopeful. I think all of us are like really hopeful all the time. But
I
but who
know, I
knows?
know.
Who knows?
We're all living on hope and
Right.
fresh air right now, because I think that is what is keeping us going. I think we have the last 2 minutes, so I'm going to ask you one last question, which I think has been something that a lot of people keep asking us. What is your advice to individuals? Any top 3, 4 things that you want to say, who want to go back to living their normal lives in this post-COVID world and still want to safeguard their health, irrespective of where they come from and what they're doing? Because I think the question of immunity is a good one, but we can't rely on that alone anymore.
So my advice to them is you will have to redefine your normal. And the redefinition of normal does not need to be like really bad. You can still, for example, hang out with your friends, but you'll have to make sure that it's an open space. You'll have to make sure that everybody is distanced from each other. You'll have to make sure that everybody is wearing a mask. Eating and drinking with each other adds the element of risk to the whole situation, because you will have to take your mask down to eat and drink. But then, at least you would try your best in terms of having an open space. It has to be open air, and of course maintaining your distance at all times. When you talk about things, when you talk about normalcy in terms of going to work again, I think it would have to be done with the same caveats in place. You would have to wear a mask at all times, and avoid activities that are kind of unnecessary. So avoid hovering together. I was advising people about how to manage re-entry into the work, and one of the things we said very clearly was, don't line up at a cafeteria, for example, for food. Make sure everybody has boxed meals that are just given out. Go back to your desk and eat it. So common sense measures that will have to be in place, which will be the new normal. So you will. I don't think you will be able to return to exactly what you were a year back for some time. But the alternative need not necessarily be too bad.
So I think thanks so much for saying that, and this is the perfect note to end this on. We have to redefine our normal, if there was a normal, and now that we have a new normal, let's try and adjust to it, and we can go back to safeguarding our health in a post-COVID world. Thank you so much, Lance, and we'll see you
Thank
again.
you, Chapal.
Thanks.
Sure.
Take care.